Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic has to do with hypertension, a creation of the hormones. The creation of the hormones. When you look at hypertension, generally you want to believe that it is something mysterious, because we have the primary hypertension and that is called the essential hypertension, and the secondary hypertension. The secondary hypertension, you could ascribe it to some underlying conditions, but the primary hypertension, usually you want to believe that it's a mysterious thing that happens, but with findings, research has proven that it is not all that mysterious anymore. The truth about it is that the hormones control and regulate the blood pressure, but as soon as when certain factors are not the same anymore, it now affects this hormone production. It's either the hormones are now produced in excess or they are now deficient. That is, the quantity is really deficient, so the blood pressure is no longer regulated. You can imagine when it is produced in excess, you now find a situation of very high blood pressure, and that blood pressure, when sustained, is what is called hypertension. You have the gradient. But all these I cannot say here in this preamble, but we all know the different hormones that could cause problem, from aldosterone, the antidiuretic hormone, the renin, the angiotensin, so many. But all that I shall discuss in the slide section, and let us move gradually into the slide section where we will receive more knowledge. As usual, press the like button, subscribe, and more knowledge will be transferred from me. The outline: objective introduction, hormone associated with blood pressure, risk factors, laboratory diagnosis, prevention, and recommendations are what I shall be talking about during this video section. The objective: to expose the regulation of blood pressure by different hormones and how these hormones, excess or deficiency, which are measurable by medical laboratory scientists, are responsible for hypertension when the derangement is sustained. The introduction: hypertension has been recognized for many millennia as increased blood pressure, but it was not associated with metabolic syndrome or stroke. It was treated as benign blood pressure until the 1950s, when further evidence accumulated from actuarial reports and longitudinal studies, such as the Framingham Heart Study, showed that benign hypertension increased death and cardiovascular events. Thus, the risks were now understood to increase in a graded manner with rising BP across the spectrum of population BP. Now you can understand why once your BP is seen close to 140, you are considered hypertensive. There are even a grading by age, and all that is part of what would form the basis of the prevention and recommendation. Several hormones are involved in hypertension, including aldosterone, epinephrine and norepinephrine, renin, angiotensin 1 and 2, major hormone that regulates the blood pressure. Antidiuretic hormone 2, cortisol, insulin, parathyroid hormones, catecholamine, and etc. Blood pressure is necessarily increased and decreased to cope with the situation that presents itself, more like an adaptation mechanism before returning back to the state of equilibrium, the homeostasis. But in the hypertension case, you find that the blood pressure is high and the person is not at rest, is not at the state of equilibrium for truth. And that sustained blood pressure creates so much problem, except a drug that will reduce the effect of the hormone, calcium channel blockers, the aldosterone being reduced, and so on and so forth. These are the mechanisms by which the treatment, the drug that brings it down, which is something that is a treatment for life for majority of people, except in a situation where it is a tumor or where you can call it a nodule on the adrenal cortex, where it is now removed and the person is back to normal. But where it is not a tumor or a nodule removed, the treatment is by drug or what have you. There are so many other things, but this is not the time for recommendation. Yeah, talking about hormones associated with hypertension, we must understand that hormones are chemical messengers produced by a ductless gland directly into the bloodstream. It is that chemical messenger that will now instruct, regulate whatever it is out there to regulate. The endocrine system is a series of glands that secrete hormones that the body uses for a wide range of functions, including regulating blood pressure. When you're talking of blood pressure, we have the aldosterone, a steroid hormone produced by the adrenal glands that causes the body to retain sodium and lose potassium. This can lead to high blood pressure because the sodium absorbs more water and increases the pressure, even in patients who are already taking diuretic. Epinephrine and non-epinephrine, major hormones that regulate blood pressure, that are also renin, angiotensin, and 2-RASS. They are all major hormones that regulate high blood pressure. We shall now go into more details. Yeah, antidiuretic hormone, from the name one could easily understand, it reduces urine frequency and by so doing reduce the volume of water. Thereby it helps to reduce the blood pressure. Cortisols, as even shown in the diagram above, a stress hormone, causes an increase in heart rate and blood pressure. Adrenaline also increases the heart rate in certain dangerous situations, thereby increasing blood pressure. We also have the erythropoietin produced by the kidney, has a common side effect, and one of its commonest side effects is hypertension. Elevated insulin level and insulin resistance in adults with obesity can contribute to high blood pressure. Parathyroid hormones control calcium level in the blood and is associated with increased blood pressure because it helps blood vessels to relax and constrict when necessary. It helps direct cells to make nitric oxide, especially in erectile function. And when you are talking of penile erection, catecholamine, synthesized by PGL tumors, can cause high blood pressure. So hormones of any of these organs tumor of any of these organs can increase the hormones. Yeah, we're talking about risk factors. These are factors that I earlier mentioned that could affect especially the hormones function. And the risk factors are medical conditions that can cause high blood pressure, such as kidney, heart, or endocrine system problem, apart from it being genetic or primary tumor, as in essential hypertension. Diabetes complication, diabetes nephropathy. Diabetic nephropathy, you can understand it affects the nephrons, which are in the kidneys especially. Diabetes can damage the kidney's filtering system, which can lead to high blood pressure. Also, polycystic kidney disease and renovascular hypertension, fatty blockage like atherosclerosis in coronary artery fatties will block the movement of blood, and that could result in high blood pressure because it forces. Yeah, Cushing's syndrome too, where corticosteroid medication may cause secondary hypertension. Aldosteronism comes the syndrome, hyperaldosteronism, that is also responsible for high blood pressure. Pheochromocytoma. This rare tumor, usually found in an adrenal gland, produces too much of the hormones adrenaline and non-adrenaline, and we know adrenaline is very necessary when you want to take a flight. So that taking a flight will also affect the blood pressure. Hyperparathyroidism, the Parathyroid gland controls level of calcium and phosphorus in the body. If the glands release too much parathyroid hormone, the amount of calcium in the blood rises, which triggers a rise in blood pressure. Also, pregnancy can also worsen pre-existing hypertension. There are so many conditions that could create that hypertension situation that is sustaining it. So one must be careful to always check all these factors. Laboratory diagnosis. Hormones disorders have diagnosed in the laboratory. That is a very confident statement. You can always test for these abnormalities in the lab. All the hormones mentioned earlier have their normal range, and when the appropriate sample, blood, urine, or saliva are collected, obeying the regulation associated with timing and processing of sample of the pre-analytical stage, the result will help in nipping in the bud any derangement of values from the normal. So it is that aspect that is very necessary for me to re-emphasize, that the laboratory plays a very great role. If you are now talking of this hormonal disorder, if you are able to get this hormonal disorder on time, then you are able to correct it. Where it cannot be corrected, it could be replaced. Where it cannot be replaced, well, one probably accept its conditions. Prevention and recommendation. Hypertension in children has been associated with metabolic syndrome and obesity, which makes early control of hypertension possible by controlling metabolic syndrome that eventually damage the kidney and the heart. So what I'm trying to say there is that if children can have it and can be controlled, once you can experience that in childhood, it means a derailment is possible at any time. So that derangement is where you need the help of the clinician as well as the laboratory scientists to help get the right values. Prevention, therefore, is by healthy diet, exercise, no obesity, and check and control of blood pressure, especially if it is familiar and at a certain age. Very high blood pressure rises above 180 millimeters. So, and some are very resistant to treatment. Any blood pressure measurement below 140 to 100 is considered as a pre-hypertension stage, which requires some parameters check and change of lifestyle where necessary. In the case of hormone deficiencies, a synthetic hormone replacement therapy may be used, and in cases of excessive hormones production, medication may be used to curb the effects of the hormone. For example, a person with an underactive thyroid gland or hypothyroidism may be treated with synthetic thyroxine, which can be taken in the form of a pill, while a person with an overactive thyroid may be administered a drug such as propranolol to counteract the effects of the excess thyroid hormone. From all I have said, you can understand that the medication you use for treatment depends on the presentation, whether it's a presentation of calcium effect, where you start talking of calcium blockers, and if there is a resistance, then there is a need to change medication and see whether the other forms. There are newer drugs, but that is not my area of specializations, and as such I cannot dwell much on that. But it is necessary for one to familiarize himself with some of these medications so that you do not misinform your clinician. And like I always say, check more of this video for more knowledge acquisition. The reference is also as follows.